Hi guys, it's Carissa. I figured I'd make a video and share with you what happened today because it was interesting. But I think I have things pretty well resolved, and it's just nice to kind of get things wrapped up that have been bothering me. But I had an appointment today that I made about a month ago for a new gynecologist. I have talked about my current one in the past. Basically, I have had 4, I think, in the last 3 years. I will see them 1 or 2 times and just know it's not a good fit and try and find another one. And everyone that I go to comes highly recommended from one person or another. And this most recent one was recommended by my primary. And I think she just wanted to give me someone with experience. I certainly don't fault her for sending me to him because I don't know. I don't know. I basically told her I was having trouble finding a gynecologist that took PCOS seriously. Because believe it or not, with all the research and information there is out there, there are doctors, because I feel like I've seen all of them, that seem to think it's hogwash and blow it off completely when you bring it up. And the first few basically looked me right in the face and said, I think if you lose 50 pounds, you will get pregnant on your own. I don't think you have PCOS. And the whole thing I was saying to them was that one of the reasons I thought I had PCOS was because it was so difficult for me to lose weight. So I fought for a diagnosis for like 2 years, and finally having a doctor that would prescribe me metformin and sort of agreed to my treatments for fertility was nice. But he's very difficult to get in to see. He only works like 2 days a week. And he had kind of the same attitude, and I know some of you probably remember. He basically tried to coerce me into having weight loss surgery instead of doing IVF. And then said, you know, when I told him that I didn't care to do the weight loss surgery, he was like, well, then what can I help you with? And didn't want to see me anymore. His office also, for what is likely liability purposes, does not freely renew prescriptions. So if my pharmacy has an automatic renewal for a maintenance medication and calls their office, they will refuse it. And then I have to call and ask for a refill. And then there's this arbitrary amount of time that varies from 4 to 7 months, it seems like, where they'll say, we won't refill this until you come in and are seen again. And initially he said on metformin I would just have to be seen twice a year, but it was starting to seem like that window was getting smaller and smaller, and they want me to go in more frequently. So I thought, I don't want to have to fight for these medications, because sometimes they would take 2 or 3 days to approve the refill, even if I didn't need to get seen. And metformin is not the kind of drug that you want to be off of for any period of time. You build a tolerance to it, and if you just stop taking it abruptly, then you have, stomach issues and everything all over again. So I was really frustrated by that. And plus, I don't really want to see this man again now that I know, his feelings. He seemed so nice the first few times I went, but then when he realized he couldn't talk me into getting weight loss surgery, he just seemed disgusted with me. So it was always my plan to see someone else, but obviously at the point I'm at now, I'll have to graduate to a facility in a few weeks, and I don't have anyone new. So a friend of mine recommended her doctor, and I guess there were signs that I should have noticed or paid attention to, but for whatever reason, I didn't even think anything of it. I don't know of any gynecologists that I've seen recently or ever that weren't also in the practice of obstetrics. But when I walked in today, the nurse practitioner was talking to me for like 5 minutes, and she was like, I don't want to waste any more of your time. We don't do obstetrics here, so we can't see you. So I did tell her, I was like, look, this is frustrating because I have had a nightmare of a time trying to find a doctor that acknowledges PCOS and respects it, basically, and that I feel comfortable going to. She asked who my current doctor was, and when I told her, she said, well, I don't really care for him. And she's like, that's just between you and me. Which I thought was funny because obviously now I'm telling the internet, but you don't know who she is. But it was kind of nice to hear. It was kind of nice to hear, okay, somebody who's kind of in this, in this type of practice acknowledges that maybe he's not the best, at least for my situation. So she was wonderful. She immediately said, I know who you should be seeing, and he also can see you because she basically was like, this man's really nice, and what was the word she used? I don't remember. She described him to sound wonderful, and she also said, because you're PCOS, you would be considered high risk most likely, and he's who you'd probably have to see. So she took me to the front desk, and the woman there set up my appointment with this doctor who, I think it's in June that I would be seeing him, who hopefully I will be able to graduate onto later. It is a little bit stressful to not know who my gynecologist is or obstetrician, but that's kind of how it's always been. I have not had a decent one ever. Even going back to when I was, 18, 19, the first one that I had, he used to, back then I weighed over 100 pounds less than I do now. And he used to completely berate me for not being thinner. And I was in the best shape of my life back then. So I've always had trouble with gynecologists, and so this was kind of a breath of fresh air. But I had to figure out what I was going to do about metformin. So I called my fertility center and said, look, is there any way you can prescribe this to me until I stop seeing you? Because my current doctor makes me jump through hoops, and I'm afraid of running out. I only have 4 days left of pills. Actually, I counted. I have 4 days and 3 pills left. And I take 4 pills a day. How that happened, I don't know. But so I have 4 days and 3/4 of a dose right now. But of course, the fertility center was wonderful, and they said that they would do it, and they put in the prescription today, so I'll probably be able to get it tomorrow. And the nurse I spoke to, I believe, is also the nurse that left me my voicemail and that I saw the day of my second beta. And she's so nice. And I said, oh, you have just taken so much stress off my shoulders. And she was like, that's good because you don't need any stress right now. It was really cute. So that was interesting anyway. But I should have seen the signs. This facility I went into today said something about reproductive rights on the door. And there was a giant bulletproof glass thing around the front desk. They told me before I went there, when I booked the appointment, that children are not allowed in the office. How I didn't think of any of that or realize it at all, I don't know. I was just going to see a new doctor, So I'm just glad all that's over with. It's really, if anything, it's a funny story. And it may be getting me to a good doctor that I can continue to see. So that is good. I guess while I'm here, I will talk a little bit about how I've been feeling. Yesterday morning and this morning, I feel okay. I'm sleeping relatively well. I'm still having a lot of crazy dreams, but in the morning, my stomach feels like I'm not nauseous. That's not the word I want to use. It feels like I'm nervous. It feels like I have a big test at school or something. That's how my stomach feels. It does go away shortly after I have taken my prenatal and all my other vitamins for the morning. And I think it's because that's when I take my baby aspirin. And I have a weird feeling that little bit of, pain relief that's in that baby aspirin kind of makes a lot of that stuff go away for a few hours. Because I also have a tightness on my left side. I almost want to stretch into it so that I don't pull against it because it kind of hurts. And my lower back has been aching, but I think that might be just pain kind of, or tension kind of riding up my back from the injection site for the progesterone and oil. So I've been trying to stretch a lot, except I have to be really careful because I went to lay down earlier today when I got home from my appointment. I just laid in my bed and I was sending some emails on my phone and stuff, and I was just laying there, and I was laying on my back and I went to sit up, just like how you would sit up, I don't know, to sit up, like you're doing crunches, I guess. And I went to sit forward, and I immediately was knocked backwards, and I had to lay down for like 5 minutes because on my lower right side, it felt like just this complete lightning stretching, just jerking motion, awful instant pain. And I was like, okay, that's different. And I was trying to like figure out how it was going to roll from one side or another to get up. And it was still there for quite a while. So I realized I can't really move how I used to be able to. But things like that, I kind of love. I like it because it kind of, it's like a little whisper, like, hey, you know, something's happening, stuff's going on, and it just makes me feel better. And the only other thing that I guess I want to talk about, because it sounds crazy, but I believe in it now. Not to say I didn't believe in it before, but when my sister was pregnant with her daughter, the first, I don't know, 7 or 8 weeks in that period of time, she was saying that her pants didn't fit and that her stomach already felt like really pushed out and hard. And I remember thinking, that is impossible. That's really weird. And she was kind of embarrassed by it because she felt like she already was starting to look pregnant. So I remember I Googled it because I thought, well, maybe I can comfort her in some way and find out if it's real. And it was totally a normal thing. I can't remember, there was an actual term for it, but it's for women who have weak abdominal muscles and who tend to carry weight in their stomach. There is something that happens where your stomach just tends to just push itself out and, you know, it feels crampy already, so you're kind of not feeling comfortable, but it starts to just be different from what you're used to very soon. And I feel like I know that sounds so crazy, but I feel like that's happening to me as well. And if she hadn't said something about it, I tried to re-Google it and like find out the same information I did before, and I couldn't. So I was like, oh, whatever, forget it. I do remember what I read about it, and it was just basically like, I'm not in very good shape, and I am heavier in my stomach, so my stomach's going to just blah, you know. So, because I was walking around, I went to a few stores yesterday, I was running errands, and the whole time I felt like my stomach was just, like I needed to put it on a cart and roll it around in front of me. And so these are the things that I've noticed so far. But I love all of it. I really do. I feel really good otherwise. Nothing really. I've noticed smells a lot more. Like I was in Target yesterday, and in my mind, I was like, I didn't even think anything of it either. I keep forgetting that I could already be having aversions to smells, or it's like I have a super nose and I'm smelling things that I wouldn't normally smell. And I walked through Target and I swear I could smell every person I walked by, everything that was in every department. Like I couldn't get too close to the laundry soap aisle, and I just thought that was neat. I love all this little stuff. I'm going to completely embrace it, even when it's bad. Like, I hate tomatoes, and I really, really wanted some salsa yesterday. So first thing in the morning, I went to the store and I got stuff to make salsa because I was craving, like, not a pureed salsa, like a really fresh chopped salsa. And I made it. And I can't really say that I enjoy the way it smells because every time I open the fridge, I feel like it just knocks me out. But it was really good. And Mike had some last night, and when he went to bed, oh, he stunk. It's like it comes out of his pores when he sleeps, anytime he has onions. So that's the kind of stuff that's going on right now. And I love it. I'm really excited about all of it. So this is my progression, in case you're curious, my progression for my GYN Fail tests. It looks pretty good so far. I'm just doing one every morning and every evening, or like close to bedtime, just to kind of see the lines get darker, because I've never seen that before and I can't really get over it yet, and I still enjoy it. But it is really good peace of mind between now and my first ultrasound. And then after that, I don't think I'll do this anymore. But it's kind of just what's getting me to Friday, you know? So, and lastly, I had quite a few people who have messaged me or commented. I've had requests for the voicemail that was left for me. And I listened to it again. It seems like it's safe to play, so I'll play that for you now. Let me see. I put it on my iPad because I record on my phone, so excuse me for a moment while I get...
Hi, Carissa. It's Krista Good from CNY Fertility. I have some very good news for you. Unfortunately, we close shortly, so I'm just going to leave a voicemail, and I apologize for that, but you are pregnant. You're on your crino, so we want you to double up on that, so morning and night now. You're going to come back in on Saturday for blood work, and I'm going to put you in at 8 a.m. for that. And then also what I need from you is Dr. Kane is suggesting that you go to progesterone in oil injections, and we can teach you that on Saturday. So I'm going to go ahead and order that so we have it. So you'll probably hear from the pharmacy that they're shipping it out to you. So just so you know, the test was positive. We want you to double up on your crino morning and night. And we're going to see you at 8 o'clock on Saturday for more blood work. And then at that time, we can teach you how to do the injections. Okay? Talk to you soon. Bye-bye.
That is it. So, thank you for your interest in that, but I think it might be nice to have a record of it for myself as well. It doesn't get old to hear it, so that is it. I did finalize a list of some of the things that I noticed were different from this cycle and previous ones. I know there are people who are curious about that, so I will make that video and have it up probably, if not later today, tomorrow. I don't see any reason why that would be delayed, so I'll definitely get that up soon. And I don't think there's anything else to say right now. Thank you guys so much. All your messages have been so exciting for both of us. We're just really loving this moment right now. We're just trying to enjoy it and not worry. And so thank you. I'll talk to you guys soon. Bye.